Hi everybody, Jesse here, and welcome back to the Fit Forward Gym for a really important mobility soft tissue series on the hips, which often are the cause of most of our lower back pain. If you also have tight hip capsules and you feel like your hips pinch a little bit when you squat, run, bike, this is a really, really important series for you to do and could cure both of those issues. This series will also tell you where you're tight in your hips or your quads. If you're foam rolling your quads and one is tighter than the other, almost for sure you're getting more of a pull into your patella tendon and kneecap, which could lead to knee pain. Similar for when you rotate your hips out or do your adductors. So it's really important to pay attention to your limitations here and what muscles are tight, and some spots will need to be held a little bit longer and breathed into to truly release. So we'll begin with the quads. Now, what I'd like you to do is put the foam roller right above your kneecap here. The other leg will be out to the side, and what you'll do is you'll just foam roll back and forth from the top of the knee to the quad. Now, your quad has two insertions, the knee and the hip. And you have to foam roll both of those insertions to have a healthy, functioning quad. So this first one is really right at the kneecap, just above it in the lower part of the quad. You can also get a little bit of the outer quad here. That's going to be really tight for most people, almost into the IT band. So both those spots are great. Then you move the foam roller up more into the hip flexor, okay, and foam roll kind of top of hip, right below the hip bone, into mid quad. You can feel free to travel a little bit if it feels good. You'll have to adjust every now and then. Again, about 45 seconds on each spot. Okay, after the quad, you'll get at the glutes. Really important. And what I want you to do is sit on the foam roller and cross one leg over the other. Now you'll find that one leg is harder to cross than the other for most people. The one that's harder to cross really needs this exercise. If you can't cross your hips well, you can't access your glutes well because you're going to have all this tightness stuck right in the capsule. So here you just want to kind of start by foam rolling right into the back pocket, the base of the glutes here. And you want to kind of move your way toward the side, closer to the actual hip capsule. Get that nice stretch. If you're feeling good, you can bring that knee up a little bit. Just make sure to maintain a nice tall spine and don't round your back. And then as you get outside, you may even want to drop that leg and just get a little deeper into kind of the side of the glute here. Okay, this is hitting glute medius and glute maximus, two really important hip rotational muscles. Now, something you should definitely hit while you're here is a little tricky muscle called the TFL, which is really the main cause of most IT band syndrome I see and knee pain. And this guy is located, if you touch your hip bone and you move just below it and make a fist, that's your TFL. And it does this action and this action. So when it's really wound up, it's going to not let you access the big glute muscle. So to get this guy, you'll lay down, find that hip bone, kind of the top of your pocket, your side pocket, lean a little to the side here, and you're just gonna go back and forth. Try to get as much weight as you can on it. It's a small motion, remember, just about the size of your fist, and just go back and forth. Relieving this can often relieve a lot of knee pain. Really, really important muscle to hit. Small little ranges of motion. Now, the last place you'll get, which is often overlooked by people, are the adductors. So if you can't open up your hips in a squat, in movement, in running, whatever it is, what happens is if these guys are tight, it doesn't let you externally rotate the knee, and that outer hip and thigh and glute have to work that much harder to get leverage. So we really want to release these muscles. So to get this one, really one of my favorites for back pain, you're going to bring one knee nice and high in the air. So you can see it's almost in line with my hip bone. The other leg is just straight back here. So I'm in a lot of hip flexion. And what you want to do is start at the insertion here, and you're just going to roll in and out right by the groin. Again, keep that knee high in line with your hip bone. You'll feel a lot of sensitivity here, most likely, if you've never done this one. Back and forth there. Then go more into the VMO, or kind of right by the kneecap. Again, keep that hip high. Another sensitive spot. Another 45 seconds here. So you've got to start a little higher into the hip insertion and then move lower, closer to the knee. You can see I'm kind of turning away from it because I really want to open my hips and get that mobility. Now, if you combine all these moves together, you'll be better able to internally and externally rotate your hips, leading to better glute activation. You'll also be better at hip flexion, which means that you won't get that grabbing and pulling feeling in the hip capsule, which often leads to labral tears, and you'll be performing better in the gym and in life. Hope you enjoyed the series. See you next time.